My son, Lavelle Johnson, he's a happy child. He loves his brothers and his sisters. He loves football and basketball. As a newborn, he was diagnosed with sickle cell anemia. I really didn't know too much about sickle cell, but I'm getting to know more about it coming here.
Our patients are really resilient. I mean, they have to undergo blood draws and lab tests and imaging tests from a very young age.
I come every 2 or 3 months to see his doctors. Lavelle, he'll have blood transfusions. He just recently had surgery, got a spleen taken out. I love the doctors that help him here. They take real good care of him. They're some good people.
The families and the patients, they need you to be there for them. They need you to be strong. They are warriors and they are fighters.
To be so little and have to go through that so much pain, Lavelle, he's a strong warrior, and I love him for that. Don't give up. Any child that has sickle cell, any child that fights battles with cancer, don't ever give up. Keep fighting.
Heart disease runs in my family. In July, on a very hot day, I was walking my dog and I got short of breath. And I said, uh-oh, this is the beginning. I knew it was time for me to see a cardiologist. So needless to say, I was scared to death.
Marty had a TAVR procedure, which is a transaortic valve replacement. Once she had that procedure, she then qualified for cardiac rehab.
This program is just fantastic. It is a program that every patient who has heart surgery should go through.
It's probably one of the most fulfilling jobs you can have in terms of seeing people come in who are physically, they are not where they want to be. And then by the time they graduate cardiac rehab, they have their confidence back, they have their strength back.
That's a wonderful feeling. In fact, one of the nurses here talked to me when I was on the treadmill yesterday about me graduating, and I'm looking forward to that. I just feel much better knowing what I have in my heart now.
So I have teenagers and then a 7-year-old. So the 7-year-old is what brought me to the mom's program. I had enrolled in an inpatient rehab, and the night I got there, I found out I was 6 weeks pregnant. And I went right from that inpatient to a member of the Moms in Recovery program.
So we take care of pregnant women and mothers who are dealing with substance use disorders of all different kinds. Could be opioid use disorder, alcohol use disorder, cocaine, cannabis, anything really.
Honestly, I was kind of blown away by the model of care. So many of the limitations to care are access and means and transportation and all of these things. And I had a lot of barriers when I first got sober. You know, I mean, I was homeless and just being, thrown right into this really nurturing environment where it's not judgmental.
Our biggest concern is that many people who are pregnant or have young children are actually afraid to seek addiction treatment at all because they are so fearful of their children being removed from their care. And so it's really, really important to make these kinds of programs welcoming and accessible to people who are pregnant or people who are parenting.
I've been in recovery for almost 8 years now. In May, it'll be 8 years. Being surrounded by other moms and being built up instead of torn down was like such a huge factor in my success. And being able to recognize that I could still be a good mom and that I was still a good mom, and that this actually made me a better mom because I was able to do the right thing and be the mom that they deserved.
Olivia just turned 17 months old. When she was 11 months old, she was very active, crawling, and she started to actually get some bruises on her legs. And we decided to take her to our pediatrician. All I know, it was 11:40 in the morning when he called me. So there's sometimes you never forget. And he let me know that her blood work had come back for leukemia. I think I had a slight panic attack.
We both did.
And we were admitted to the hospital that day Dr. Herman is our primary doctor. I will never forget the first words basically out of her mouth when we entered downstairs were, "You just gained an entire family." She is just a spunky little 17-month-old. She has a lot of attitude. She is kind of the social butterfly of the pediatric floor here. She likes to go on walks and see all of her nursing friends.
It's not even just the nursing staff either. Like we've gotten to know the, environmental team, and we've gotten to know the unit assistants, and we had her first birthday here in this room. And several of the nurses who weren't on schedules came in to be with her on her birthday.
Her cure date is August 15th of 2025, so that date is definitely one we're looking forward to. I think we're gonna have a big party.
To see the level of care that people give absolute strangers has been truly humbling, and we're just so very blessed to be here and to be a part of this family now.